Hey there, and welcome to our video on the best supplements for anxiety. In this comprehensive guide, we'll be diving into the current scientific evidence behind the most promising natural remedies for managing anxiety symptoms. We'll explore supplements like passionflower, kava, magnesium, lysine, arginine, and more, looking at their efficacy, safety, and optimal dosing. By the end of this video, you'll have a clearer understanding of which supplements may be worth trying to support your mental well-being. It's important to keep in mind that while some supplements show potential for reducing anxiety, they shouldn't be viewed as a replacement for conventional therapies like medication and therapy. Supplements work best when used under the guidance of a qualified healthcare provider as part of a holistic approach to managing anxiety. So, let's jump right in and uncover the best supplements for anxiety relief. First up, let's talk about passionflower, a climbing vine native to the southeastern United States that has been used traditionally to treat anxiety and insomnia. A double-blind, placebo-controlled study by Akonzade and colleagues in 2001 found that passionflower extract was as effective as the benzodiazepine drug oxazepam for treating generalized anxiety disorder, or GAD. The study involved 36 patients with GAD who received either passionflower extract or oxazepam for 4 weeks. Both treatments significantly reduced anxiety symptoms, with no significant difference between the two groups. Another study by Movafeg and colleagues in 2008 looked at the effects of passionflower on preoperative anxiety. In this randomized, double-blind, placebo-controlled trial, 60 patients undergoing inguinal herniorrhaphy surgery received either oral passionflower or placebo 90 minutes before surgery. The passionflower group experienced a significantly greater reduction in anxiety compared to placebo. A combination herbal product containing passionflower, valerian, and St. John's wort was also found to be effective for reducing anxiety in individuals with adjustment disorder, according to a double-blind, placebo-controlled study by Burin and colleagues in 1997. While these studies suggest passionflower may be helpful for anxiety, more research is needed to establish optimal dosing and long-term safety. Mild side effects like dizziness and confusion have been reported in some trials, and passionflower should be used cautiously in combination with sedative medications due to potential interactions. Next, let's move on to kava, a plant native to the South Pacific Islands that is one of the most well-studied herbal remedies for anxiety. The roots of the kava plant contain active compounds called kavalactones, which are believed to be responsible for its anxiolytic effects. A meta-analysis by Pitler and Ernst in 2003 reviewed 7 randomized, double-blind, placebo-controlled trials of kava for anxiety and found that kava was significantly superior to placebo in reducing anxiety symptoms, with an effect size considered to be medium to large. A 3-week randomized double-blind trial by Boehner and colleagues in 2003 compared kava to 2 conventional anti-anxiety medications, buspirone and opipramole, in 129 outpatients with generalized anxiety disorder. Kava was found to be as effective as the 2 prescription drugs in reducing anxiety symptoms, with 75% of patients in the kava group classified as treatment responders. Saris and colleagues in 2009 conducted a 3-week crossover trial involving 60 adults with 1 month or more of elevated generalized anxiety. Participants received kava or placebo for 1 week, then switched treatments after a 1-week washout period. Kava was shown to significantly reduce anxiety compared to placebo, with no serious adverse effects reported. While kava appears to be an effective and well-tolerated treatment for anxiety, concerns have been raised about its potential for causing liver toxicity. However, a review by Teschke and colleagues in 2011 analyzed 85 published case reports of kava-associated liver toxicity and found most cases involved the use of kava extracts that did not comply with standard quality requirements. When taken at recommended doses and from reputable sources, kava is considered to be a safe and effective treatment for anxiety. Moving on, let's discuss St. John's wort, a flowering plant that has been used for centuries to treat a variety of conditions, including depression and anxiety. While St. John's wort is primarily used as a natural antidepressant, some studies have investigated its efficacy for anxiety disorders. However, the evidence for its efficacy in anxiety disorders is mixed. A double-blind, randomized, placebo-controlled trial by Kobach and colleagues in 2005 examined the effects of St. John's wort on social phobia and found that although it was well tolerated, it was not significantly superior to placebo in reducing social anxiety symptoms. Another randomized, double-blind, placebo-controlled study by Bach and colleagues in 2005 investigated St. John's wort for obsessive-compulsive disorder and found that it was not more effective than placebo in reducing OCD symptoms. A combination product containing St. John's wort and valerian was studied for the treatment of anxiety with comorbid depression in an open-label, uncontrolled study by Miller and colleagues in 2003. Significant improvements were observed in both anxiety and depressive symptoms, with good tolerability reported. However, more high-quality, controlled trials are needed to determine whether St. John's wort is an effective, standalone, or adjunctive treatment for anxiety. It's important to note that St. John's wort should be used cautiously as it can interact with many medications, including antidepressants, birth control pills, and blood thinners. Next up, let's talk about lysine and arginine, two amino acids that have been studied for their potential anxiolytic effects. Lysine is a precursor to the neurotransmitter gamma-aminobutyric acid, or GABA, which is involved in regulating anxiety and stress responses. Arginine is a precursor to nitric oxide, a signaling molecule that plays a role in various physiological processes, including neurotransmission. A double-blind, placebo-controlled study by Smriga and colleagues in 2007 investigated the effects of a lysine and arginine combination on anxiety in healthy adults. The lysine-arginine group experienced significant reductions in state anxiety and salivary cortisol levels compared to placebo. Jazova and colleagues in 2005 conducted a randomized, double-blind, placebo-controlled trial examining the effects of lysine and arginine on stress response in high-trait anxiety individuals. The amino acid combination was found to significantly blunt the stress-induced rise in cortisol and subjective measures of anxiety. While these initial studies suggest a potential anxiolytic effect of lysine and arginine supplementation, more research is needed to replicate these findings and determine optimal dosing and long-term safety. No adverse effects were reported in the above trials, but high doses of arginine may be contraindicated in individuals with herpes infections. Now, let's discuss magnesium, an essential mineral involved in over 300 enzymatic reactions in the body, including the regulation of neurotransmitters involved in mood and anxiety. Magnesium deficiency has been associated with increased anxiety and stress vulnerability in observational studies. Several randomized, double-blind, placebo-controlled trials have investigated the effects of magnesium supplementation on anxiety. Hannes and colleagues in 2004 studied the efficacy of a magnesium-containing herbal supplement in 264 patients with generalized anxiety disorder. After 3 months, the supplement group experienced significant reductions in anxiety symptoms compared to placebo. A study by Tarleton and colleagues in 2017 examined the effects of magnesium bisglycinate supplementation in 112 adults with mild to moderate subjective anxiety. The magnesium group showed a significantly greater reduction in anxiety symptoms compared to placebo, as measured by the State Trait Anxiety Inventory. Boyle and colleagues in 2017 conducted a systematic review and meta-analysis of 18 randomized controlled trials investigating the effects of magnesium on subjective anxiety. The analysis found that magnesium supplementation was associated with a significant reduction in anxiety compared to placebo, with an effect size considered to be moderate. While these findings suggest magnesium may be a promising natural treatment for anxiety, it's important to note that not all studies have found significant anxiolytic effects. Magnesium is generally well tolerated when taken at recommended doses, but high doses can cause gastrointestinal side effects, like diarrhea. Magnesium supplements may also interact with certain medications, such as antibiotics and diuretics, so it's important to consult with a healthcare provider before starting supplementation. In addition to the supplements we've discussed so far, several other natural remedies have shown promise in reducing anxiety symptoms, although the evidence is more limited compared to the aforementioned remedies. These include ashwagandha, an Ayurvedic herb that has been shown to reduce anxiety and stress in several small randomized controlled trials. L-theanine, an amino acid found in green tea that has been shown to promote relaxation and reduce stress without causing drowsiness. A randomized, double-blind, placebo-controlled study by Kimura and colleagues in 2007 found that L-theanine significantly reduced subjective stress and salivary alpha amylase, a marker of sympathetic nervous system activity, in healthy adults. Omega-3 fatty acids, essential fats found in fish oil that have anti-inflammatory and neuroprotective properties. A meta-analysis by Su and colleagues in 2018 found that omega-3 supplementation was associated with significant reductions in anxiety symptoms, particularly in individuals with clinical anxiety disorders. Chamomile, an herb traditionally used for its calming and relaxing effects. A randomized, double-blind, placebo-controlled trial by Amsterdam and colleagues in 2009 found that chamomile extract significantly reduced anxiety symptoms in patients with mild to moderate generalized anxiety disorder. Lavender, an aromatic herb commonly used in aromatherapy for its relaxing and anxiolytic effects. A systematic review by Donnelly and colleagues in 2019 found that lavender essential oil inhalation was associated with significant reductions in anxiety symptoms across several randomized controlled trials. While these supplements show potential for reducing anxiety, more high-quality, large-scale trials are needed to fully establish their efficacy and safety. As with any supplement, it's important to consult with a qualified healthcare provider before starting use, particularly if you have any pre-existing health conditions or are taking medications. In conclusion, several natural supplements have shown promise in reducing anxiety symptoms based on the available scientific evidence. Kava and passionflower have the strongest research support, with multiple randomized controlled trials demonstrating their efficacy in various anxiety disorders. Magnesium, lysine, arginine, and other herbs and nutrients like ashwagandha, L-theanine, omega-3s, chamomile, and lavender also show potential anxiolytic effects, but require further study to confirm their benefits. It's important to emphasize that while these supplements may be helpful for managing anxiety, they should not be viewed as a substitute for conventional therapies like psychotherapy and medication. Supplements are best used under the guidance of a qualified healthcare provider as part of a comprehensive treatment plan tailored to your individual needs. When considering supplements for anxiety, it's crucial to choose high-quality products from reputable sources and to be aware of potential side effects and interactions with medications. Start with the lowest effective dose and monitor your symptoms closely. If you experience any adverse reactions or your anxiety worsens, discontinue use and consult with your healthcare provider. Remember that anxiety is a complex condition with multiple contributing factors, including genetics, environment, lifestyle, and personal history. A holistic approach that addresses both the physical and psychological aspects of anxiety is often the most effective. This may include a combination of supplements, therapy, medication, relaxation techniques, exercise, and dietary and lifestyle modifications. If you're struggling with anxiety, know that you're not alone and that there are many evidence-based treatment options available. Work with your healthcare provider to develop a personalized plan that supports your mental well-being and helps you achieve greater peace of mind. And that wraps up our comprehensive guide on the best supplements for anxiety. We hope you found this information helpful and informative. If you'd like to learn more about natural remedies for anxiety and other health concerns, be sure to visit nutritionmarket.com.au. At Nutrition Market, we offer a wide range of high-quality supplements and natural health products, as well as a virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today to get personalized advice and support for your health goals. Don't forget to hit the like button and subscribe to our channel for more evidence-based health and wellness content. And remember, while the information in this video is informed by research, it should not replace advice from your healthcare provider. Some scientific findings may still be under investigation, and it's always best to consult with a qualified professional for personalized recommendations. Thanks for watching, and we'll see you next time.